Mr. Fluff. How are you today? My name's Jama. I'm going to be your nurse today. So right now what I need to do is I need to do a head-to-toe assessment. Is that okay with you? All right, thank you. All right, so what I'm going to do is I'm going to inspect everything. I'm going to start at your head, work my way all the way down to your toes. Are you having any pain right now? Okay, what would you rate it 0 to 10, 10 being the worst? Perfect. Do you need to go to the bathroom or anything before we get started? All right. Can you give me your full name, please? All right, and your date of birth? Perfect. Do you know where we're at? All right. What year is it? Okay. And then do you know who the president is? Perfect. All right, I'm going to go ahead and grab your vital signs if that's okay. I'm going to check your blood pressure over here. All right, that looks good. I'm going to get your pulse. All right, and then check your temperature. This is going to go under your tongue. Okay, and then I have a pulse ox. This is just going to go on your finger, okay? All righty, perfect. All right, so all of your vital signs look normal. So what I'm going to do is I'm going to go ahead and start my assessment if that's all right with you. Perfect. So inspecting your hair, just checking, make sure the head is normal. Okay. Good. Right, and then I'm going to look inside your ears if that's okay. All right. All right, and I have a light I'm going to shine in your ears. Both ears, then I'm going to check this side. Okay, shine my light in here. Okay, perfect. All right. Check your face. Okay, can you smile for me? Perfect. Right. And then I want you to look at me. Perfect. Now, if you don't mind, look at the object up on the wall. All right, and I'm going to shine a bright light in your eyes. Perfect. And then I'm going to do it to the other eye. Perfect. And then I'm going to have my finger here. And what I want you to do is I want you to follow my finger without moving your head, please. Perfect. And now I want you to follow it in. Good. Alrighty, so your eyes look normal. They were equal in size. So now if you don't mind, I'm just going to look in your nose here with my light. Perfect. And then can I have you hold one nostril and take a breath out of the other? I'll help you. Take a deep breath in and out. Perfect. And we're going to do it with the other nose. Good. All right, and then if you don't mind, I'm going to have you open your mouth big and wide for me. I'm going to take a look with my light here. Perfect. And no pain or anything in your mouth? Good. All right, so I'm going to work my way down. I'm going to check your neck here. Count for a full minute. Right. And then we're going to do the other side. All right. I'm going to just feel here. Is there any pain or anything when I'm touching? Good. Looking to see if it's normal inside size. Perfect. All right. So what I want you to do is I want you to follow me. We're going to be moving your head, and I want you to do it as best as you can on your own. So the first thing we're going to do is we're going to move it to the side, and then all the way to the other side. And then I want you to do your chin to your chest, back up, and then back. Perfect. Any problems with that? Okay. All right. So now what I want to do is I want to look at both of your arms here. So I'm going to uncover you a little bit just so I can see them. Okay. Feeling they're the same temperature. Not seeing any swelling. Perfect. All right, I'm going to check your pulse on both sides. It's equal. Okay. And then I want you to squeeze both of my hands here. Good job. Popliteal pulse. All right. And so now I want you to follow me again with your arms. So what I want you to do is I want you to raise up both arms above your head, bring it down, and then try to move it out as much as possible. Good. Were there any complications with that? All right. So we're going to move both of your wrists. I want you to just do circles and then make a fist for me and release. Good. Were there any problems with that? All right. So now what we're going to do is I'm going to check the resistance. So I want you to put both of your arms out and hold it for as long as you can. Count to 10. All right. And so now what I'm going to do is I'm going to apply pressure down, and I want you to try to lift me up at the same time, okay? All right. Good. And now we're going to do the opposite. I'm going to be pushing up, and you're going to be pushing down. Perfect. Is it okay if I lay you flat right now? Okay. I'm going to remove this pillow here and lay you down. And then I do want to lift up your shirt if that's okay. All right. So what I'm going to do right now is I want to listen to your lung sounds and your heart rate. All right. All right. Listening to your apical heart rate. Take a deep breath in and out for me. Perfect. All right, so I'm looking to assess that everything is equal, the color is normal, temperature is normal. And then now what I need to do is I need to listen to your stomach. So I'll have you just breathe normally for me and try to stay quiet, and I'll listen to this really quick. So I'm going to start at the right lower quadrant and listen for a full minute. Listening for 5 to 30 sounds. Go up to the right upper. Full minute, 5 to 30 sounds per minute. Left upper. And the left lower. All right. So when was the last time you had a bowel movement? Yesterday, perfect. Are you having any problems when you urinate? Okay. And then any problems with your genitory system, any concerns or anything like that? Okay, perfect. So I'm going to feel your stomach if that's okay. I want you to let me know if you have any problems, okay? Or any pain. Okay. All right, was that okay? Perfect. All right. So the next thing I need to do is I need to look at your legs. So if that's okay, I'm going to lift up the blanket and expose them, okay? Perfect. I'm sorry, I'm making you cold. I'll give you your pillow back though. All right. So have you had any pain in your legs or any complications with walking or jogging or anything like that? Okay. All right. So checking the color, checking back of the knee. Okay. I'm going to check the pedal pulse. Okay. So I'm inspecting your legs. They look good in color. Checking the calf. I'm not seeing any redness, any tenderness back here. Okay. How about on this side? Perfect. All right, so what I want to do is I want to have you lift your legs and hold them for a second. Okay, you can put them down. And so now what I want to do is I want to lift up one leg and I want to move it up. Good. Any problem with that? Perfect. So I'm going to bend your knee up. Okay. And then I want to pull it out a little bit. Good. All right, so we're going to do the other leg if that's okay. So we're going to bend it up. I want to bend it at the knee. And then we're going to push it out a little bit. Perfect. All right, does that feel okay? All right, so I'm going to just check your reflex in your knee if you don't mind. So I'm going to just lift up and I want you to put your weight completely on me, okay? All right. Perfect. And we're going to do the other leg. All right. So if you don't mind, I'm going to look at your feet now, okay? So I'm going to take your socks off. So I'm checking for any swelling. Have you had any swelling that you've noticed that's been abnormal? Okay, perfect. So checking, pushing on a bony prominence. I'm not seeing any edema. Okay. Looking at your toes. Everything looks normal there. So what I want to do is I want to have you push against my hand with your feet. Good. And I want you to pull towards your own body. Great. All right, have there been any problems with that? Any pain? Okay. All right. So what I need to do next is I need to inspect your back. So is it okay if I help you roll over? Okay. So we're going to roll over together. I want you to grab that handrail and I'll help you, okay? So we're going to roll, roll, roll. Perfect. All right, so I'm going to listen to your back. I'm going to also look at it. You might feel me move your gown really quick because I just need to check your buttocks area if that's okay with you. All right, checking the back of the head just to make sure that there's nothing there. Not seeing anything. All right, I'm going to listen to your lung sounds. So what I want you to do is I want you to take a deep breath. So deep breath for me. Deep breath. Deep breath. Perfect. Deep breath. Breathe in. Take a breath. Perfect. Take another breath for me. Another breath. Take a deep breath. 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 Perfect. All right. Just feel your spine. All right, just taking a peek. I don't see anything, no redness or anything like that. Okay. All right, so I'll lay you back here. Get you all covered up and I'll bring you in some fresh water. You have your call light here on this side of the bed. I'm going to put your arm rails up, okay? Do you have any questions for me? All right. Well, if you need anything, just take your call light and we'll come in and check on you here frequently, okay? All right. Thank you so much.